The number of people who have gone without health insurance has risen by 20% in the last 10 years. The new healthcare reform will expand coverage to the non-covered, reduce premiums, and it will also reduce out-of-pocket costs. The healthcare reform bill will help a few different people. Number one, it will help families. And by helping families, it will basically ensure protection to the families that are insured. The insurance companies can no longer place a lifetime cap on your insurance. A lot of insurance companies will only allow you a certain amount in a lifetime, and sometimes you will hit that gap. And if you hit it, that's all they'll cover, and then it's all out of pocket from there. So the new law states that they are not allowed to do that anymore. Also, if you lose your job, and when you lose your job, you lose your health care coverage. And for a lot of people, this is really important. If you have a pre-existing condition, insurance companies can no longer turn you down. I know with my kidney problems, if I was to lose my job and find another job and go to it, they tell you have to wait at least a year to get coverage. Well, now with this new healthcare reform bill, they no longer can do that. If you have a pre-existing, they have to honor it. They also do free preventative screening for men, women, and children. They do colonoscopies for free now with the healthcare reform bill, which allows people to get tested for cancer, and it also allows women to get mammograms done for free to test for breast cancer, which is very important. Another group that the healthcare reform bill helps is the senior citizens. If you're a senior citizen, insurance companies will deny you coverage or a higher interest or higher premium on your insurance due to high blood pressure and diabetes. Those are the two main things that insurance companies really look at. So with this being said, the healthcare reform bill will no longer allow them to judge on that. They have to cover you. It's easier for the elderly to get covered if they are diabetic or have high blood pressure. Another thing it helps with the senior citizens is on your Medicare, there is a Medicare Part D, which is your prescription drug coverage. And basically what that is they allow you so much to be covered per year. And there will be a time where you hit a donut hole where you've hit the coverage and it's lapsed situation. And what the new healthcare reform bill will do is if you hit that, then the government says, well, we will pay 50% and you pay 50%. That way you can still get your prescription drug coverage. The healthcare reform bill provides stability, security, and choice for all American people. And by this being said, the hidden tax is very important. When you pay for your insurance now, they throw something in there called the hidden tax. And what this is it's a tax that they add onto your insurance that helps pay the government for those who do not have health insurance. So if they were to go to the hospital and get hurt, then what you paid in tax will go towards that since they're not covered. So it's basically you're paying for someone to take care of them. So with the new law, there is no more hidden tax. You will no longer be charged a higher premium to include that tax for those who don't have coverage, because the healthcare reform bill has a insurance that lets people who are low income or have no money get on insurance or a government program that has health insurance. There will also be tax credits. And with this, when you do your taxes every year, there will be a bracket. If you fall into the bracket for this tax credit, you will receive an extra amount to help get insurance so you are covered. When the full bill does go into effect, if you do not have insurance, then they will fine you. So with this tax credit, it will help you pay for insurance if you don't have any. I've cited my sources from the United States Department of Health and Human Services, where I got on and read a lot about the healthcare reform bill. I also watched an interview with President Barack Obama in Iowa City talking about what is going to happen in 2010 for the healthcare reform bill. And I also watched the interview with Kathleen Sebelius, who is the secretary on Larry King Live, talking about the pros and the cons for the healthcare reform bill.